Yes, people, welcome back. I'm just going to go through basically a nutritional guide, part 2. That's 4. Part 2 for injury and recovery, specifically focusing today around wound healing, which can be efficacious or worth trialing if you've just had a surgery that you're recovering from or looking to recover from, that's upcoming, and want to enhance your recovery, make it quicker, and reduce scar tissue formation, because you want to look beautiful all over your body. So I'm not going to pretend that this is all coming off the top of my head. It's very in-depth research that I've done, but it's also coming from my laptop in terms of notes. But hey, we're not all perfect. So what we want when we're sort of trying to repair the tissue is angiogenesis. So basically that is just the formation of new blood vessels, which play basically a critical role in many physiological and pathological conditions, such as wound healing. And it's basically achieved by increasing VEGF. That's what we'll refer to it as through the rest of the presentation video sort of thing. So it's Vascular Endothelial Growth Factor, which is one of the most critical and specific factors that stimulate both physiological and pathological angiogenesis. So what do we also want when we're looking to repair after surgery, or just repair wounds and minimise any muscle and bone losses? We'll just run through it. So what we want is epithelial and bone formation, so that is via collagen production. You want immune function, because your immune system will be somewhat compromised, because there's a lot going on. You're trying to repair your wound, or repair from a surgery, heal, that sort of thing. So we want to support the immune system as much as physically possible. So we want a reduction in oxidative stress as and where we can, so the body can focus on just repair. We want to reduce edema, which is like it's like a watery bloat sort of thing, and it can be around wherever you've had the surgery or the cut. Bruising, pain, and overall healing time, which just makes sense. We want less bruising because it hurts. We want less pain because it hurts. We want more healing time, because healing time can also be a predictor of scarring. So the longer it takes to heal, the more likely it is you scar. We want hyaluronic acid in the wound, not for you to be placing hyaluronic acid for your body in the wound. We don't want you to be just pouring it in. We want your body to be able to produce it. We want amino acids for growth and repair. That will be provided through protein intake, but we'll go deeper into it. Wound reopening to be minimised, because if it opens, then we have to go through the repair process again. We want stem cell production, as this can help with just the overall repair process. The more stem cells you have, the more spare cells you have to be able to just facilitate that production. We want mitochondrial biogenesis. So just, we know the mitochondria is the powerhouse of the cell, so we want our cells to be working optimally. We want to reduce and protect against cartilage loss, which is obviously within your joints. You want to prevent muscle loss. We want increased growth hormone, increased IGF1 and angiogenesis, which all contribute to that reduced muscle loss. And obviously, like I said, we want increased recovery speed. So just back onto the angiogenesis, basically, if you have it dysregulated, It will contribute to many diseases, including heart and brain ischemia, neurodegradation, but so basically, like, you know, if you have a brain fart, it just happens more often. It's like aging, you know, more Alzheimer's, Parkinson's. So we want to support it. Delayed wound healing, hypertension, so high blood pressure. So if it's not supported, angiogenesis is not supported, these can, things can come down the line in the future. So we basically want to be supporting it all the time, but specifically, it's of vital importance going through the wound healing process. Of note though, with angiogenesis, we don't really want to be increasing or doing anything to increase it if you do have a cancer or you have an existing tumour, because that can stimulate the growth of it. However, if you haven't, then this is what we want to be focusing on. So to increase angiogenesis, one of the things that we obviously have to increase is VEGF, Vascular Endothelial Growth Factor. Yeah, so we can do this in multiple ways. First way is through lutein, which you can find in many different foods. So if you would to just Google lutein rich foods, you'll be able to see what this consists of. So dark green vegetables such as spinach, kale, broccoli, egg yolk, peppers and grapes. A little side note, spinach, you'd want to wash it before you use it, because it's one of the dirty dozen. It has high pesticides, so if we wash it first before we eat it, that is the best way to go about it. Then we have another way to increase VEGF is through Basalin, which is found in skullcap. It's a Chinese herbal medicine. So that is increasing VEGF and angiogenesis by activating an estrogen pathway and a PGC1 alpha pathway, which is basically determined by protein synthesis. So this is why it's important to, in order to facilitate this angiogenesis, we want to have regular feed-ins of protein. If you're a younger individual, probably about 18 to 40, or 18 to 50, 20 to 40 grams of protein per meal will stimulate protein synthesis. However, as you get older, they are more sort of protein or anabolic resistant, so it means it's harder to build muscle mass. So we need to stimulate protein synthesis, we need a higher degree of protein, so 70 grams per meal will help stimulate it optimally. On that note, protein is extremely important for growth and repair, and you do not want to be in a calorie deficit when you're trying to repair your body. So therefore we can take a gram per pound of body weight. So if you weigh 160 pounds, that's 160 grams of 160 grams of protein. If you weigh 200 pounds, 200 grams of protein. Simple. Don't want to be in a calorie deficit because your metabolic rate goes up when you're injured, and we need all the help we can get, nutrients we can get. If you're in a deficit, you're starving your body, it's not getting the nutrients it needs to survive, and we need to survive. That is a priority. The faster we repair, the faster you can get to whatever your body goal is after this. So moving on, mitochondria, we want to support it. It's basically the powerhouse of the cell, and it drives the ability for the cell to do its job. In a more scientific way, it plays an integral role in sensing an inflamed or otherwise hypoxic, so hypoxic tissue, so one that's lacking oxygen, and allowing the transcription of genes necessary to ensure adequate delivery of nutrients and oxygen to the tissues through extension of blood vessels via angiogenesis. So angiogenesis is creating new blood supply, and then the mitochondria are helping facilitate nutrient delivery to the tissues that need repair. So it is within our interest to increase and enhance the efficiency of mitochondria, and we can do this the most bioavailable option in ubiquinone or CoQ10, both supplements that you can find on the market. Then we've got stem cell production. Now I won't go into this too deeply, but one of the limiting factors of stem cell production can be poor blood sugar management. So if you're type 1 or type 2 diabetic, your body is inflamed, and which goes against the ability to produce stem cells. So we want to manage blood sugar. We can do this by having regular set meals, not constantly snacking. Have meals which contain protein and fat on their own. We can do carb cycling that way. You can have protein, carbs and fat. If you have protein and carbs on their own, you can use glucose disposal agent or pair it with fibre to slow the blood sugar spike, or don't make it as significant of a rise. Or you can just add vinegar to some of your meals, and that can help make the blood sugar spike shallow, control it a bit more. Also, high cholesterol can get in the way of this. So what we'd want to avoid is low smoke point oils. So stuff that easily oxidizes, and we don't want to be cooking at high heats with these oils like vegetable oils, etc. And you can use to lower cholesterol some niacin, which will just help the stem cell production process. Also, we want immune function, so we want vitamin D3 and vitamin C. Vitamin C helps our bone marrow grow stem cells by promoting their proliferation, so meaning just increasing numbers. Vitamin D3 can reduce the aging of our stem cells, making them healthier and help differentiate or turn into other types of cells. So stem cells are just basically the dormant cells. Well, not dormant, but they're ready to turn into the cells that we need them to turn into, to fight the infection or help with the healing process. Similarly, if you've got like blocked veins and arteries, a vitamin K2 can help reduce that and lower your cholesterol. So in terms of muscle loss prevention, obviously again we want to do the stuff to stimulate VEGF, which we've gone over. We want to increase growth hormone, which stimulates IGF1, which is massive in growing new muscle tissue. If you're an enhanced athlete, you can just take growth hormone. But if you're natural and you just want to do it the natural route, sleep increases growth hormone production naturally. However, once you're injured, obviously, and if the pain is significant enough, you can struggle to sleep. So in this case, things that can help with your sleep, obviously we know during growth and repair, the main focus for sleep we want is deep sleep. So what we can do to do that is take a CBD oil, which enhances deep sleep, or you can just take a melatonin, 1 milligram starting dose should be enough to get you somewhere around to help you sleep. But if you're older, or if you're trying to fight cancer prevention, 30 milligrams upwards has been seen in the literature. Also, creatine has been shown, as we know, well, you take it to enhance your muscle function, but basically in rehabilitation after immobility, studies have shown creatine supplementation resulted in an increased rate of muscle growth and strength gains compared to placebo, meaning, you know, if you want to get your muscle back to support your joint and just get back to performing, as an athlete or a normal human being, creatine will help. and oxidative damage is thought to be a contributing factor for muscle loss, also by increasing muscle protein breakdown, so by reducing oxidative stress post-surgery after the inflammation phase. We just want to eat a diet rich in antioxidants, etc., etc. To reduce against and protect against cartilage loss, so that's obviously in between the joints, so if your knee cartilage gets run down, then just joints won't feel as good basically. And it can actually come from being inactive, therefore rapid recovery is ideal to maintain the cartilage. So all these things are sort of feeding into keeping the cartilage by enhancing the recovery and getting you back on your feet as quick as possible. Once you are recovering and you have function back in the muscle, and say you're trying to lift heavy or lift weights, a BFR strap can help. So a blood flow restriction strap around the leg or the upper limb can help with regaining muscle at a lot lower loads. Also supplementation wise, glucosamine and chondroitin protect cartilage and reduce cartilage loss. So they're just little helpful ones. Moving on. So we'll move on to stuff that you can take prior to surgery now. If you are going through surgery, and if not, this is helpful to take throughout the wound healing process. So this can be taken prior and after. So you've got 25,000 IU of vitamin A, so it's required for epithelial and bone tissue development, cellular differentiation and immune system function, everything that we want there. So it benefits the wound by enhancing the early inflammatory phase, which is necessary for the wound to repair, including increasing the number of monocytes and macrophages at the wound site, increasing collagen activity, so you want more collagen in the wound. Can you hear that, mate? Let me try and speak over it. And it's basically stimulating the immune response, which is what we want. It can also help, well, a vitamin A deficiency will also reduce fractures and reduce fracture repair, will reduce tendon damage repair, so we want to not be deficient, but in the short term 25,000 IU of vitamin A a day will help with that. Fucking hell. I might have to move you closer. Jesus. The rain is madness. Anyway, moving on, I just have to talk louder and you can turn the volume down if this is too loud. Vitamin C next, 1 to 2 grams. Vitamin C is an essential cofactor for the collagen synthesis. Obviously we want more collagen and other organic components of tissues such as bones, skin, epithelial walls and connective tissue. And if you have a lack of it, it leads to poor immunity, easy bruising and bleeding, which you don't want obviously, and slower healing of wounds and fractures. Therefore, we want a sufficient amount. Moving on, zinc, 15 to 30 milligrams per day, all of this is per day. Zinc is essential trace mineral for DNA synthesis, cell division. We want more cells, protein synthesis, all necessary for processes for tissue regeneration and repair. Again, deficiency has been associated with poor wound healing and collagen synthesis. And particularly important, zinc demands are thought to be the highest in time of wounding throughout the early inflammatory phase. So once the demands are high, we need to feed it with the appropriate amount of zinc. Similarly, we've got lactic acid, which has been found 50% faster wound healing time than water alone. And vitamin E alongside that enhances absorption, which is critical for the formation of red blood cells which distribute oxygen around the body. We want oxygen to the injured part of the body. And there. Then we move on to the amino acids. Arginine, you can take 3 to 15 grams per day. It's a non-essential amino acid that plays a key role in protein and amino acid synthesis. It's essential and efficient for wound repair and immune function. And it basically increases IGF1, which is the control molecule for wound repair. Moving on, glutamine, another amino acid that we've spoken about before, alongside chondroitin for your joints and tin. Glutamine is used by inflammatory cells within the wound for proliferation and as a source of energy, so we need that source of energy in there. Fibroblasts use glutamine for the same purposes as well as protein and nucleic acid synthesis, which is basically DNA, building your DNA. Because optimal functioning of these cells is paramount for the healing process. Glutamine is a necessary component of tissue repair. It's released from skeletal muscle, so from your muscles following injury and surgery, which can cause a relative deficiency of glutamine in skeletal muscle and the gut. And intestinal uptake is reduced as well, so therefore we have to supplement it a replacement dose, as we will become deficient if not. Then post-op, once your wound has sort of healed over, we can start topical application of a couple of things. Aloe Vera and Centella asiatica, I don't know how to say it. So it may facilitate the creation of flexible, fine and high tensile strength at the wound site, meaning basically the wound has less chance of it reopening, and you get a bit of softer skin from doing so. It also enhances collagen synthesis. It increased the breaking strength of the wound again, so it didn't come apart. And the aloe vera increased the collagen content of granulation tissue, which is again needed for repair. So collagen as well, on a side note, can be found you can take a dose of 2.5 to 10 grams a day through bovine and marine collagen, or you can take it through bone broth. And when you're taking in that collagen, add 50 milligrams of vitamin C to enhance absorption. Similarly, 750 to 1,000 milligrams of bromelain post-op may reduce edema, bruising, pain and healing time following the trauma and surgical procedure. So basically it reduces bruising, pain, increases healing time, everything that we want. Bromelain can be found in stuff like pineapple and kiwi. And again, you just Google bromelain rich foods, whack it in, or you can alternatively supplement it. So as we mentioned before, the prolonged healing process is an important contributing factor to abnormal scarring. So if you want a big fat scar and you think it's cool as shit, then take as long as you want. But if you want less scarring, then the best thing to do is try and get the healing process done as quick as possible and sort it out. And these things here are what we've helped to facilitate. And then finally, what we've seen is bio oil for scar tissue provides for 93% of people soft and supple skin, quick absorbance, improves skin appearance for 61%, and the skin and scarring was less pronounced in 51% of people. So that can help with your scars after, for your wound healing. I will just emphasise at the end, avoid raising angiogenesis if you have any existing tumour or cancer, and Caution should be advised when supplementing with vitamin A in patients for whom inflammatory effects of steroids is essential, such as rheumatoid arthritis or organ transplants, as well as pregnant women and women of childbearing age. References will be provided in the description. I hope you find some value in that. I can put the whole write-up in the description as well. And you can see what I'm talking about. But yeah, that was a long one. Took a lot out of me even just fucking chatting. Now we can relax and get back to being optimal as fuck and parasympathetic. Alright then. Daniel Bradley over and out.